sit on the Chamber of Commerce with and inspiring women, which she definitely is. So, Andrea is our pelvic floor expert. Please help me welcome her, Dr. Andrea Nied.
Thank you. Thank you guys so much. I forgot my clicker, 1 second. Thanks for having me. This is so fun. I love doing these talks. I frequently speak to other groups of women and people in the community. I do church group talks, other gyms. So I love spreading pelvic floor knowledge and awareness. It's a huge passion of mine because we don't learn this stuff. No one tells us about how to heal our pelvic floors. You guys, I went to physical therapy school 13 years ago. I didn't learn a single thing about the pelvic floor in physical therapy school. Isn't that messed up? And once I realized the importance of this work, I had to go out and get all this training so I could help you guys out. Okay, so this is me. Again, my name is Andrea. I've been a physical therapist for over 13 years. I started my career out in like geriatrics, so I was seeing a lot of older individuals in rehab settings. That was fun for a while, then I felt like I needed something different. Then I went and worked in a clinic with more sports performance, surgical stuff, tons of patients all day long, treating ACLs, shoulder, rotator cuff, total knee replacements, things like that. That was great for a while again, and then I got pregnant and had my first child in 2016. And, I'm a physical therapist, I'm active, I'm doing all my things, I'm doing my core exercises, I'm moving my body. I had that beautiful baby right there, that's Addie. And then I go back to work and I'm like, what's going on here? I still don't feel great. And I'm a physical therapist and I know how to move my body and be strong. And I'm having all this back pain. So I work with some great people. They're trying to treat me and help me out. And I'm not getting better. And my boss at the time, he was like, well, maybe it's your pelvic floor. I'm like, no, it's not. I have a great birth, maybe a few stitches. I feel fine. I'm not leaking. I'm not, having any problems with that down there. And I went to my first pelvic floor course, and I was absolutely blown away, you guys, because when we did a pelvic floor assessment, that pelvic floor was causing my back pain. I had pain shooting up my back from my pelvis, and I had no idea. And I was a physical therapist, and I thought, holy cow, there's people out there that don't have the anatomy knowledge I do, and they are so stuck. And I have to do something about this, so I need to do this. I need to be a pelvic floor physical therapist. And so I had my son Tommy in 2017, so those two kiddos are back to back. I had a lot more issues after that second one, even though, again, I'm a pelvic physical therapist. Things happen in your body that you cannot control and burst sometimes. So I had bladder leakage. I was doing really good for a while, and then I got a Peloton, and I noticed I had bladder leakage with more aggressive movements, getting up on the pedals, more hit-type movements, jumping, laughing, coughing, sneezing. I'm doing this stuff. So I was like, okay, I need to work on myself and go seek some treatment from someone in the community. During that time, too, we moved to London. So that picture in the top corner there, I moved to London with a 9-month-old and a 2-year-old. I don't know why I did that, but it was fun. My husband got a job there, and he was like, you're gonna kill me. But we honestly always dreamed of living abroad, and we lived there for 3 years. We were there during COVID, which was an interesting experience. I won't get into that too much, but while we were there too, I became licensed as a UK physiotherapist. So that's what physical therapists are called over there, physios. And I just wanted to help people in my community. So I started my own practice out of my house, and I went to other people's homes as well. So I was doing pelvic floor. People didn't want to go back to the hospital or the big clinics, so they would come see me because everyone was afraid of COVID. And so it was really fun, and I loved working over there. in Colorado so much. We missed Arvada. Luckily, we kept our house, so we didn't have to buy another house in the market. And, after many discussions with my husband right there, he's like, you gotta do this. You gotta keep up with the pelvic floor thing. You gotta have your own business, and so you can really grow it. I didn't want to be a pelvic floor therapist in a big clinic with a lot of other, dudes walking around and guys. Like, that's just not a very welcoming environment to a woman, I think. I opened my business. We're called Movement Physio and Wellness. We are just 5 minutes from here up the road on 64th Indiana, and that is a picture of the outside of my building. I'm next to Qdoba, and that is my staff right there. So I'm looking to have some other therapists on my team to help me out. I'm here to spread the word about pelvic health. Here we are. So why should I care about my pelvic floor? Has anyone ever coughed and peed? Has anyone ever sneezed and peed? Has anyone ever done a really hard hip workout and peed? Yeah. So you should care about your pelvic floor. These issues are common, but not normal. I think I heard Brittany say that too. A lot of stuff is common, but not normal. We should not be living with these issues. And unfortunately, our society has really normalized a lot of these problems. I cannot tell you how many times I've had someone call my office and they've told me they've been leaking for 20 years. And I just feel awful for these people. It's like, my profession wasn't really around that much 20 years ago, so I get it. But, we're here now, and it's really grown in the last 10 years in terms of my specialty within physical therapy and pelvic floor health. So, it's never too late, you guys. It's never too late to get these problems solved. We can fix these problems for good, stop living with them. Sometimes the hardest part is just realizing oh, I do have a problem. How many of you have a problem? So we can definitely help you fix these problems. So getting back to living your life and not worrying about these embarrassing issues. So for a lot of people too, it's important to fix them because it's not just about peeing your pants, it's about something bigger. Maybe it's about one of your children is getting married and you want to wear a really cute outfit and you're worried that, if you wear pads, you might see it, or what if you have to pee a million times and you're going to miss walking your child down the aisle or something like that. It's always about something bigger, and so we really want to understand what are your big goals in your life. What's your big why? Why do you want to get this fixed now? Because that'll just help us reach our goal. All right. Okay, so what does a pelvic floor issue look like? So I'm going to run through a couple of these things right now. So listen to these problems and see if any of these sound familiar for you. So the first one you probably all think about when you think about the pelvic floor is bladder. So bladder issues are commonly leakage issues. So we can have different types of leakage. We can have leakage that occurs with the cough, the laugh, the sneeze, the jumping. That's called stress incontinence. That's when a pressure is going in your body and you can't control the urine coming out for several reasons that I'll jump into a little bit later. So stress incontinence is when you pee with a pressure. Urge incontinence is when you pee on your way to the toilet, like you're running home from work, you're driving home, you're pulling into your driveway. Oh my gosh, that urge just came on. I can't get out of the car fast enough. I can't open the garage door fast enough to get in my house. Oh, I just peed. So that's basically what urge incontinence is. It's having that incontinence when all of a sudden the urge hits you so quickly that you don't know what to do and you pee your leak on the way to the toilet. And then frequency too. So how many times a day do you think it's normal to pee? Someone shout out a number. 5.
Every hour on the other.
Yeah, so normal daytime urination is about 5 to 8 times a day. That could be anywhere from 2 to 4 hours. What we consider frequency, going a little bit too much during the day, is more than 10 times, or about every 30 minutes. Was anyone ever told just to like pee just in case, like, oh, I'm going to the grocery store, but I just peed 15 minutes ago. I better just go again because, we create some of these habits too ourselves, guys. So a lot of that we're working on in physical therapy too, to retrain behavior patterns. Because sometimes it's not just about how the body is in terms of like what's going on with the pelvic floor. Sometimes it's behavioral issues too that we can help you work through and figure out why you're having this problem. Bowel issues. So for pelvic floor physical therapy, we are looking at the whole pelvic floor that goes from the pubic bone up here all the way to the tailbone here. So everything you see is part of the pelvic floor. There's a little bit of hip muscles in there too. This is looking from the top down, from up to bottom. So you can see muscles in the pelvic floor go all the way to the front to the back. So a lot of times we're having bowel issues and we don't realize it's a problem with our pelvic floor. One of the biggest issues we can have is constipation. So we can have tight pelvic floor muscles that are not able to stretch and relax as we eliminate bowel. We can have incontinence of bowel, so we're trying to get to the toilet and unfortunately have a little bit of staining or streaking. And sometimes we can have an issue called fecal smearing, which is we wipe and wipe and wipe and we don't ever get clean too, and that can be a pelvic floor issue as well. Okay. Sometimes with bowel stuff too, we're working with people with like IBS, Crohn's disease, stuff like that too, because a lot of their muscles will like tighten up and have difficulty working in proper ways. So a lot of times people have other bowel issues too that we're working on the pelvic floor side of. Sexual dysfunction. So the biggest one we see all the time is pain with intercourse, and that's a big one. I really want people to understand that it can be common, but it's definitely not normal. You should never experience pain with anything like that. And our pelvic floor has this ability to remember things. So kind of like Jennifer's talk was talking a lot about like mind, body, mindfulness, and trauma. If something happens to your body, unfortunately, there's such a large percentage of women that have been sexually assaulted that we really know about. Because it's not being reported. The body remembers, and we create trauma and store those emotions in our pelvic floor. We have a big autonomic nervous system component to those muscles, and maybe you're with a great person, and things are going well, but maybe something happened to you in the past, and you're with a new person, and unfortunately some of that stuff's coming up, and you're getting pain with penetration. So. That's a big one. We're working on not only getting those pelvic floor muscles to relax, but also working with some mindfulness things and mental health things as well. We're also working with women who just struggle with inability to orgasm and have a good time. So blood flow is important for these pelvic floor muscles, and so if we're not having a good time, we should have a good time. Postpartum, a lot of people might just think, oh, pelvic floor therapy is just for someone that had a baby, postpartum mom, which is a big part of our practice. We see lots and lots of postpartum ladies for a variety of reasons. Obviously, trauma can happen to the pelvic floor in terms of tearing. Sometimes we can have small tears on the outside of that perineum. Sometimes we can have deeper tears into more of the bigger parts of the muscle belly that may require surgery. And so we're working with these women based on what symptoms they're having, because they might have bladder leakage, they might be trying to get back to have a sexy type of husband, it's not working. And they might have, we'll get to it a little bit later, a lot of other issues too. Pregnancy too. So I love working with pregnant women. I feel like sometimes they don't really know what to do when they're having pain. So a lot of times they'll tell me, like, I called my doctor and they said, like, okay, just rest or put your feet up or maybe do a couple of these stretches. Maybe they're going to a chiropractor too, which I think is great. I work with a lot of chiropractors, but the biggest issues I see are just like movement issues. Some of them are afraid to move their bodies in the way that they should be moving to maintain strength and flexibility. Birth is a physical sport. I want people to be in shape for birth. It is absolutely exhausting on your body. We are the go-to people for helping women get out of pain in pregnancy. So unfortunately, sometimes I hear, like my doctor said, like if I'm treating a woman who's 8 to 9 months pregnant, my doctor said I have to wait till I give birth for me to feel better. And I said, no, we can definitely help you out. Let's start this now so postpartum is a little bit easier. Things like pubic symphysis pain, where you have pain in the front pubic bone, SI pain on the butt area. Those are some common ones, and round ligament pain into the belly. So if anyone you know is pregnant, we can definitely help with that. Just pelvic pain in general. So this could look like a variety of things. Sometimes we're really stressed out. We sit all day for work. We don't move our bodies the way we should. So when you don't move your body, what happens? Things can tighten up. And so maybe we've been in this constant state of stress. We're working a lot. We're not really moving our bodies. We go to maybe join FitBody or do something more active, and we're realizing we're having some issues. So that could be just pain anywhere in the pelvic floor area. Sometimes we can have nerve-like pain, burning, irritation, all sorts of things. So hip pain and back pain too can be a pelvic floor issue. With hip pain, there is a muscle that connects from the pelvic floor to the hip joint. It's a muscle I work on all the time. That was actually the muscle on me that was referring pain up my back. And so sometimes when people come in and they say like, I'm having hip pain, but I'm also leaking a little bit, or I'm really struggling with my my urgency. I'm gonna look at the hip, but I'm also gonna definitely look at the pelvic floor. So a lot of those things are interconnected. And back pain too, you guys. Obviously, there's crazy statistics out there that up to maybe 80% of our population has experienced back pain at one point in our lives. Another crazy stat is that out of the people with back pain, 95% have pelvic floor dysfunction. Like 95%. That's crazy, but we can definitely help that. The reason that can happen is I like to think about your abdomen like a core canister, like that soda can. So our pelvic floor is the bottom of the can, the diaphragm is the top of the can, the abdomen is the front, and then the back muscles are the back. So if things aren't working so well in your back's really tight, your abs are weak, something's going to go on in your pelvic floor to try to compensate. So we got to work all sides of that soda can. And that's it. Okay, when should I go to pelvic floor therapy? So, really it's like all the things we just spoke about. So, anytime you're experiencing a problem with your bladder, bowel, sexual health, what I tell people is, as females, we have 3 holes down there, and if you have a problem with one of the holes, that's what you probably should call someone like me. Who else works on this stuff is like you call your primary care doctor, you call your OB-GYN, maybe they're, and they have their specialties and they're going to request or maybe suggest medications or other lifestyle things. But, what we're really focused on is what's happening in this pelvic floor in terms of movement. So, like I already talked about pregnancy, I love doing birth prep with women, so maybe they're not even having a big issue in terms of back pain or bladder leakage. Maybe they're just kind of nervous about birth and kind of scared and they don't know what to do. So we do birth prep, where we educate them on how to stretch the pelvic floor, so working on that perineum to create space so hopefully you don't tear during birth, and opening up the hips and the back and getting the body physically ready for birth. Like I said, it's quite the experience and marathon to birth, and I want people to be in shape for it. Postpartum recovery, so some of these specific things we see a lot of postpartum C-section recovery. So a lot of times, has anyone had a C-section? Yeah, some people in here have C-section. So I love the work we can do for C-section mamas, and we can help them with getting that scar to heal nicely, getting those core muscles to work better because they cut several layers of tissue, and it takes time for those layers to heal and then get strong again. You know, a lot of women are really concerned about like how the scar looks, so we're talking about that and maybe educating on different creams or things like that, or just massage techniques. It's really important to massage your C-section scar. Sometimes people feel like they don't want to touch it, they're just, they got a C-section, they, they really wanted that vaginal birth and they had to have a C-section, so sometimes it's hard for people to come in and work on the C-section scar, but we kind of talk through that and work through that and really want people to heal up their abs, obviously. And then sometimes, even though you had a C-section, people still have pain with intercourse, bladder leakage, stuff like that. And I think that's really confusing for them because they didn't have a baby go out that way, came out the abdomen, and they're a little confused about, well, why am I having this pelvic floor issue? And I always like to talk about, well, your body carried that beautiful baby for 9 months, and the weight you gained, your pelvic floor is holding up your baby, and all the fluid that was inside you, and we need to make sure that, after the baby comes out, we can still have some dysfunction of that pelvic floor in terms of how it works, how it lengthens, and how it's strengthened. So, prolapse is a big one. I love treating prolapse. I feel like a lot of people out there feel really lost about what to do about prolapse. This is something you can definitely help with pelvic physical therapy. Sometimes people really benefit from a device to help support the vaginal wall too. Well, first let me tell you what prolapse is. A prolapse is when we can have a dropping of one of the walls of the vaginal canal. So maybe the front wall is dropping down, so the wall that's shared with the bladder drops down, or the wall that's shared with the rectum drops down into the vaginal canal. Maybe the cervix and uterus is coming down a bit. So what this looks like is you might notice a bulge. You might feel a bulge at the opening of your vaginal canal. You might feel heaviness down there. You might feel like there's like a golf ball in my underwear. I've heard a lot of different things. You might feel like, I've heard people say, it feels like a tampon is going the wrong way. What else have I heard? Anyways, I had prolapse too. After my second kid, even as a pelvic floor physical therapist, things happen in the birth, and unfortunately, I think due to a little bit of my genetics too, you're more likely to develop prolapse if your mother has had it as well. You can experience prolapse. So I obviously have been able to fix myself and have the assistance of colleagues to help me out with that. So I love doing prolapse because I have that personal experience with it. And another thing about prolapse is you can get a device called a pessary to help support your vaginal wall too. Some of these are life-changing for women too. This is something that's fitted by a urogynecologist, OB-gynecologist with the training to put that in correctly. I'm looking forward to doing this training eventually. It's now within our Practice Act to fit pessaries, so I will be doing that at some point when I get time. Diastasis recti, so that is a separation of the abdominal wall from pregnancy. So when we are pregnant and we're 9 months pregnant, everybody has diastasis recti. Everybody's muscles have separated, the ab muscles in terms of allowing that baby to grow. What happens with diastasis recti is when the abdominal wall doesn't close back up nicely and we don't have good force and tension through our abdomen. So what this might look like is someone that has like a lot of bloating, a lot of distension. They might notice bulging right down the middle of their abdomen. And they might feel like, I've been doing core exercises now forever, and I still feel like I look 6 months pregnant. What's up? And really, that can come from not loading the body correctly in terms of, maybe just not doing the correct right exercises. Sometimes just other tissues in the body are preventing that abdominal wall from closing back up too. So, like when we treat people with diastasis recti, a lot of them say like, I went back to the gym, I've been doing everything I did, I took a bunch of YouTube videos, I bought an online program, and it's not getting better. But we're able to kind of figure out like what's truly going on there. And so, like, I'll give you an example. I had someone come in recently, and she's And I noticed, I was like, there's a big scar down the middle of your belly right here. What's the scar from? She's like, oh, I had back surgery, but they went through the front side. And there was a ton of scar tissue, and guess what? There was all this pulling down here and all this opening up here. So I was like, we need to work on the scar tissue down here. That's why your abs haven't closed, is you have all this stuff going on down here that's tight and weakness up here, so let's work on that. So, stuff like that where we can point out to people. She's like, I had no idea. I just knew I had a scar, and that's there. So, sidetrack. So yeah, when should you go to pelvic floor physical therapy? Any pain in the pelvis, the back, and the hips, with or without problems with bladder, bowel, and sexual issues. Like I said, because we have a lot of muscle attachments into the pelvis, from the back, from the inner thighs, from the abdomen. Especially when we do have those problems with the holes, we definitely want to seek help from the PT with pelvic floor experience. Menopausal issues. So we're working with women who are in peri or postmenopausal times. This is a time where we're experiencing more things like joint pain. We see a lot of frozen shoulder in women going through menopause. We see a lot of other hip and back joint pain. And a lot of times people are reaching out to us because they've been fine for 20 years, they've had their kids, all of a sudden they start peeing their pants again and not really changing anything in their lives, and they're like, what is going on? And a lot of times these women are coming in and having a new issue with pain with intercourse too. So a lot of that comes down to what's going on in those tissues in terms of the estrogen. Are we getting good, elasticity in those tissues? Do we maybe need a little bit of topical estrogen? You need to talk to your doctor about. And then doing that, usually working with pelvic floor PT can really, really help. Usually it's a lot of lengthening these pelvic floor tissues. And I just threw in there male pelvic floor because I treat men and not a lot of people do. And I love working with men because those poor guys have nowhere to turn. And when something goes wrong with their genitals, they freak out. And, I'm literally talking these guys off the ledge. They're like, I'm like, you're going to be okay. Yeah. They're a lot of fun to work with. So what can I do now to start my journey to healing my pelvic floor? So I'm going to talk about a couple things here. And as we get to them, if you feel comfortable getting up and moving with me, that would be great. I'm going to show you a couple things on the ground. I know we all have cute outfits on, so if you feel comfortable getting down on the ground, I'll demonstrate a few things. I might just kind of wing it and demonstrate a few things you can do with like a chair or table too if you're not comfortable getting on the ground. So here we go. We have been talking a lot today about stress and sleep, and I think that is so, so important. A lot of us are trying to deal with the issues in our body by physically changing something in terms of I'm not doing the right exercises, I'm not doing blah, 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 I'm not going to the right gym. It's we have to tap into this sleep and stress stuff for sure. And how I like to do that is I teach everyone how to do some diaphragm breathing. So we did a little bit of breathing with Jennifer in the beginning, but I'm going to talk about how to really get into this diaphragm. So your diaphragm is under your rib cage right here. So everyone put their hands on their ribs. The low ribs. Your diaphragm is a big umbrella muscle in your rib cage. When we inhale with the diaphragm should lengthen and drop down. And when we exhale, it should come back up. Okay? The pelvic floor and the diaphragm are friends. When we inhale with the diaphragm, the pelvic floor should lengthen. When we exhale, the pelvic floor should gradually recoil. So we're going to inhale the diaphragm, and we're going to practice being mindful and letting all the tissues relax in our pelvis, our sit bones, that area. So let's all inhale and imagine our ribs going out to the side like this. We're going to exhale and let it recoil. And inhale. Imagine you're creating space all around your rib cage down here, 360 degrees around. Keep breathing. A few more breaths. Inhale. exhale. Look at what's happening in your chest. Are you trying to get air in by going up here? That's going to do the opposite of what your pelvic floor wants to do. We need to think about creating space in that pelvic floor to start to heal a lot of these issues, okay? So if you're going to take away one thing from this talk, it would be to practice diaphragm breathing, to be honest with you. A lot of times people come in and I teach them this and they tell me, I've been breathing the other way. What are you talking about, this diaphragm breathing? That's not how I breathe. Yeah, okay, that's probably part of the problem too. So let's fix it. Let's switch it up. And we can make sure we're breathing correctly, not only for the nervous system, but for the mechanics of how the pelvic floor and the body work together. So we need length before we need strength. What does that mean? I want your pelvic floor to be flexible before I give you other exercises to do. So what does that look like? I'll talk about it like a biceps muscle. So we have our biceps, so we're contracted and we're relaxed, right? So I'm squeezing and I'm lengthening. If our pelvic floor cannot go into that full lengthened position, so if I'm only going from here to here, this is my pelvic floor, and I go to cough or laugh or sneeze and I need a good pelvic floor contraction to help me not leak, I am not really generating much force here. Okay, the pelvic floor is actually tight and weak. If I can lengthen my pelvic floor, I can create a nice strong contraction to stop myself from peeing my pants. Okay? So we're going to get to that a little bit more about Kegels in the later slide, but we need length before we need strength. Pelvic floor stretches. So we're going to learn how to do a few pelvic floor stretches here. And who wants to get down on the ground with me? Okay, let's do it together. Put your skirt on. Okay. Well, let's go on your knees and knees. Yeah. And you can point your butt that way if you want, so you're not flashing everybody. Yeah, it's really cute. If the people in the back, if you want to stand up, you're welcome to. So you probably all know how to, if you've done yoga, you know how to do like a cat-cow, okay? So we're going to do it with diaphragm breathing, okay? So she's going to go down into cow pose, where she's going to let her belly drop down. She's going to act like she's a massive burrito in her belly. She's going to let it hang out. And she's going to take a big inhale breath here. And then she's going to exhale and round her spine into cat pose. Awesome. Tucking your head, tucking your tailbone, getting a good spinal mobility there. So she's going to, she's done this before. She's going to inhale and drop her tummy again. So we're inhaling on the cow pose. Belly is soft. Do not contract your abdomen. Exhale on the cat pose. Okay. This is going to help the movement of the pelvic floor and the diaphragm together. Okay, so we're inhale, drop your tummy, stretching your pelvic floor here. Exhale, around your spine. I'm not really doing a Kegel here. I kind of tell people, just focus on your spine. Just move your spine. If we can move our spine, we can move our pelvis nicely. Good. I also love a little like puppy pose. So if you go down on your elbows, and again, the outfit is limiting us maybe a little bit. But I like to do this little puppy pose and get my hips into internal rotation. I'm going to get my feet wide. So your feet are going to go wider than your knees. Yeah. Get your feet a little wider than your knees. And then normally when I do this, like I have people like fully rest their head on the ground. Belly is super soft. Again, the outfit. But it looks kind of like this. And your tummy is fully relaxed. You're trying to get to a spot where you feel like I am opening up the back of my pelvis. What do you notice with this? Anything? Your knees probably aren't wide enough because of the skirt. Yeah. But we're trying to open up the back of the pelvis by turning the thighs inward a little bit. it to create space in the back. You can put a bunch of pillows on your tummy. You can like find a nice supported position. You could also do this in a chair or table, like lean forward and just stick your butt up. And just try to think about dropping your sit bones, dropping your anus, just like letting everything relax, turning your feet in a little bit there too. So like that'd be a good thing for at work. You're really stressed out, you're